Master Anatomy and Physiology with Indramani Pandey.
Welcome back, guys. Today we can talk about disorders, treatments, and therapies related to cartilage. Before we move on to today's topic, I just want to check your, understanding of different types of cartilage. Let's do some practice problems here, and we'll move on to today's topic then. Okay. So as you can see, I have different criteria, and you just need to figure out which belongs to which cartilage. Okay. Covers the ends of the movable bones. Okay, let's just select this hyaline cartilage. Let's say this is 1, right? Fibrocartilage, let's say this is 2, and elastic cartilage, let's say 3. Okay, we're gonna assign these numbers on each category. Alright, let's start with this. Covers the ends of movable bones. What is that? That should be hyaline cartilage, which often known as articular cartilage also. It prevents friction, wear and tear on the bones. Okay. B is found in the epiphyseal plate. What type of cartilage is that? This is also hyaline cartilage. Okay. Now another one. It's predominant in the pubic symphysis. What type of cartilage is that? There are two types of cartilage we usually see there: hyaline cartilage and the fibrocartilage. The fibrocartilage is the dominant one. Okay, connects the vertebrae to one another. What is that? That should be fibrocartilage also. Forms the meniscus. What is that? This is also fibrocartilage. Connects the ribs to the sternum. This is often known as costal cartilages, right? But we usually consider that as a hyaline cartilage. So costal cartilage is a subtype of hyaline cartilage. That's it. Now you understand, right? So let's move on to today's topic. Cartilage disorders. Okay, when there is a disorder in the cartilage, we often feel pain. Okay, the pain is due to the injured, inflamed, or damaged cartilage. You can injure, inflamed, or damage your cartilage due to sport injury. There might be some genetic factors, or that might be due to osteoarthritis, right? These are the things that's going to give you a pain, which is very difficult to tackle. You're going to realize if you're going to have cartilage disorder. Okay, this pain only going to be felt by those people who actually know what cartilage disorder is. Okay, they know like how it feels like. Okay, so here are some examples of disorders that can happen in the cartilage. As you can see here, the first one is called cauliflower ear. As you can see in the picture here, right? The ear is like looks like cauliflower, right? So a severed up outer ear, right ear, like here, right? And the ear appears like pale due to the loss of blood. Okay, and what happened is your cartilage like here is dead. Okay, the cartilage is dead, which is abnormal. As you can see, this is the normal ear and this is abnormal. Okay, this is abnormal. So what's, it can happen during sports injury. Think about that. Think about wrestling, right? Think about wrestling. What happens? What happens is when during wrestling, if someone hits really bad in your ear, what's going to happen is injury going to lead to the blockage of that artery there, and that's going to prevent the blood flow, and that's going to lead to the tissue damage. Okay, so if you are a boxer or wrestler, be careful on that. Sometimes when you pierce your ear in the upper area, like here, when you pierce your ear here, right, and you can have infection, okay, that can lead to the cauliflower ear also. Second is costochondritis. Can you find here what is costochondritis? This one, right? Look, this red thing means there is inflammation going on there. Okay, that means inflammation. the inflammation at the junction of these ribs, right? These ribs and this sternum. At the junction there, you have inflammation going on there. Okay, that joint infection, okay, or that joint inflammation is due to like different types of infection, which can be viral infection, bacterial infection, or fungi. Okay, if you do heavy lifting or strenuous exercise, you may have same sort of problem. Okay, tumors like cancerous and non-cancerous cells may also involve in costochondritis. Okay, growth plate fracture, which is here, right? It usually seen in child. Okay, it is usually seen in child and occur in bones of the fingers, forearms, and lower leg. Okay, if you have a car accident or if you fall from like certain heights, right, you may have that type of problem also. Okay, that's one another thing we need to understand here. Okay, so now another is called meniscus tears. As you can see here on the knee, you have a menisci which is made up of, we already did this exercise, fibrocartilage. Okay, so this is also called a torn meniscus. Okay, so when you forcefully twist your knee, okay, then it can cause that disruption in the structure of that meniscus, and you may have a torn meniscus. Okay, so this meniscus tear is also called as a torn meniscus. Okay, perfect. So how that can happen? When you forcefully, okay, when you forcefully bend or twist your knee, that can happen. Okay, and each knee has what? So each knees have two menisci. These menisci are usually C-shaped in structure. Okay, C-shaped in structure. And if you have a meniscus tear, you can do rest, ice, and medication for the treatment. What might be the symptoms? Knee instability, right? If you messed up your meniscus, you may not play well. If you are a soccer player or something like that, right? Inability to move knee, you may not able to extend or flex your knee like leg, right? So persistent knee pain, which is very 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 painful. Okay, very very painful. Okay, here another is called achondroplasia. We're going to talk about this like more in detail in next lecture, but what I want to mention you today is achondroplasia is related to a bone disorder. It is related to a bone disorder. So what happens here is, it prevents somehow, uh, the cartilage can't, okay, can't change into a bone. Okay, so usually what should happen is cartilage should change into bone during development, but it cannot. Okay, so cartilage, right? Cartilage, and if you try to go to bone during development, if it cannot go, if it somehow stops, then it's going to result a disorder called dwarfism. Dwarfism. So achondroplasia leads to dwarfism. Okay, this is due to a gene mutation, some sort of like some kind of gene. We're going to talk more in detail about that in next lecture. The mutation in gene causes achondroplasia. Most cases, the achondroplasia is not inherited, means it's not going to go from one generation to another. But if it inherited, then it follows a rule called autosomal autosomal dominant pattern. Okay, autosomal dominant pattern means it's not going to skip any generation. Every generation going to have this sort of problem. Okay, that's what we need to know in today's lecture. We can talk the mechanism, right? How it happens, what type of gene, and those type of thing in next lecture in greater detail. Okay, there are different treatments that we can do to treat those disorders associated with cartilages. One is called arthroscopy and MRI. arthroscopy and MRI, how it works is basically arthroscopy is basically a surgical procedure. Okay, what you do is you visualize and diagnose and treat the disease. So this is a visualization sort of thing. Okay, and you diagnose the disease and you treat that. In MRI, though, what happens is you use a magnetic resonance imaging. Okay, you use a strong magnetic field to identify that disorder and treat that with a proper treatment. Glucosamine supplements, right? So it is actually very important for joint. This is really, really essential for the joint health, you can say, right? And if you have a joint pain, we can do glucosamine supplements. We can take that. Okay, keep off the health of our cartilage. It actually really, really supports joint. If you have glucosamine supplements, that is really helpful uh, to uh, to treat joint pain. Okay, you can consider that as one of the treatment option. Joint replacement is really mean like you are replacing the joint, right? I don't want to just go in detail about that. The name itself implies that you're trying to replace your joint, right? Physical therapy, it is useful for functional mobility. Okay, this is useful for functional mobility. Okay, this means like hand manipulation or what type of maybe massage or whatever you want to do. Like physical therapy is basically a functional mobility. Another is called debridement. What does that mean is the name suggests debris. Think about that. Okay, it is a removal of damaged fragments of cartilage. If some cartilage are damaged, right, or let's say fragments of cartilage are present, for example in the knees, we just gonna remove these fragments. Is this a permanent solution? May not be. Okay, it does not increase the risk of arthritis, but it is a short-term benefit. It is a short-term benefit. It might not be a correct choice. Okay, another is called marrow stimulation. We do for a specific location. We cannot do this for all type of location, only for certain location. And I just don't want to go in detail on that, but just think about that marrow stimulation does exist. Okay, we can stimulate the marrow and do the treatment for cartilage. Autologous chondrocyte implantation, which is often known as ACI, it is a biopsy of healthy cartilage. We do a biopsy. It is a biopsy of healthy cartilage. What we do is amplification of isolated chondrocytes. We isolate the chondrocytes and we amplify that and treat that particular disorder related to the cartilage. Okay. Now, in next lecture, we're going to talk about achondroplasia in greater detail, the underlying mechanism on that, right, and how it works and what percentage of people are affected by this type of disease, and is there a real cure for that or not. Thank you for watching. See you next time.
Please subscribe to see more videos regarding anatomy and physiology.